Tomorrow, FBI Director James Comey is scheduled to appear before the House Intelligence Committee. Friday, we sat down with Democratic leader Nancy Pelosi and asked her why she thinks FBI Director Comey what he should say in public, that there is no evidence for President Trump's wiretap allegations.
I think it's really important because that's a terrible accusation to make. And what are they doing but doubling down on it now, quoting sources saying that the president worked with the British intelligence to also spy on the president. Of course, it's not true. So let's just grow up. Why doesn't it grow up? The Justice Department, the FBI has to really clear this. Because otherwise, this administration has decided that they, with impunity, can say anything. And it's really damaging.
So you think Director Comey should come to the hearing and just put this on the table and clear this up right away?
I think he should, and certainly if he doesn't, I think that he should be asked to do so, and why wouldn't he?
Do you have faith in Director Comey to carry out the investigation into Russian efforts to meddle in the election and any connections with the Trump campaign?
Well, I think it's possible that he can do that. I think that what he did was wrong during the election, but I don't know who they would appoint. There's always a question of that. But I've always had admiration for Director Comey before he was there, when he was Assistant Attorney General, and he acted very courageously in the Bush administration when it came to surveillance and the rest of that. There's a mixed record there, and I'm hopeful that he could go forward in a very positive way. And I think it's important for the Director of the FBI not to be subjected to the president thinking he's going to investigate him, so he would terminate his service.
Let's switch to health care. When you were trying to get the Affordable Care Act through, you said it needed to pass in order for people to experience what was in it, for them to, what was in the bill, but people, in order to experience what it was offering, they needed to have some interaction with it. Isn't that essentially what Paul Ryan is saying?
No, thank you for asking that question, because you can have me put it in context. The Senate had not acted. They were asking about the impact of the bill. So we have to pass it, we have to get through the legislative process. But all of us learn from the implementation of the bill, and there's some things that we could do to improve the implementation of the Affordable Care Act right now, and wish the Republicans would work with us to do that, or we can work with them to do that. But what they have put forth is a terrible bill. 24 million people kicked off of health insurance, which the Speaker calls an act of mercy. An act of mercy. And then at the same time, they put out a budget which the OMB director, Mulvaney, says is compassionate to take money from Meals on Wheels and give it to the Defense Department. We all want to support, we take an oath to protect and defend our country, but our strength is measured in more ways than just taking money from the health, education, and well-being of the American people, which is a source of our strength. So compassionate acts of mercy, I don't know what faith that is.
When you look at this health care bill that's been put forward, is it Ryan care? Is it Trump care? Is it Republican care? How do you think about it?
I think it's Trump care. The fact is this: the president really either doesn't know or doesn't care about what is in the affordable health care. The affordable health care's purpose was to lower cost, expand access, and improve benefits. It has succeeded in all three. It should be respected for what it does. We should judge it for what it doesn't do and work hard to improve it. Some places need improvement because the Republicans obstructed that implementation of it. So when he talks about his bill, imagine a bill that takes 4 million people out of health insurance, gives the biggest transfer of wealth in our country's history, $600 billion taken from working class families in our country, middle class and those who aspire to it, to the top 1%. $600 billion. Robin Hood in reverse. Some people call it Ryan Hood. But this is Trump. The Republicans will find any excuse to pull money up to the high end at the expense of the working class. And what's so strange about it all is many of the millions of people who are benefiting from the Affordable Care Act voted for Donald Trump. They live in red areas. That money will be taken from red areas, and many of the people who will be advantaged by the money going to the high end will be in blue areas. How's that? It's so wrong.
As you have said, there are issues with the Affordable Care Act.
Yes.
I mean, there are high premiums, high deductibles. In some places, there's only one insurer. Insurance companies are leaving. Have the Democrats offered something that could meet them halfway, meet Republicans halfway, or to deal with some of those issues?
No, it's not a question of halfway. It's like a little bit pregnant. You either have health care or you don't. You either have an agenda that is a public-private partnership or you don't. But the individual market is challenging, and we can do more to help on the individual market. The co-pays and the out-of-pockets, they will go up more under Trump care. You cannot retain any of the benefits of no pre-existing, no discrimination on pre-existing condition, no lifetime limit to that benefit that people have. Child can stay on your policy until 26. You can't do that unless you have the big pool that the Affordable Care has and you have a mandate. You can't say, I'm going to give you all the goodies, but none of the responsibility. And that's what the president is saying. But I think listening to him, and I listen to him very carefully, I respect the office he holds. I respect the people who voted for him. He doesn't know what he's talking about. And when he says death spiral and this and that, he really doesn't know what he's talking about. That's most unfortunate. And so this product is Trump care.
The president says, and he said, if we submitted the Democrats' plan, drawn everything perfect for the Democrats, we wouldn't get one vote from the Democrats. What he's saying essentially is there is such opposition.
When he speaks, understand that he's projecting.
But what could you work with the President Trump?
Well, first of all, we're not working with anybody who says we're going to repeal the Affordable Care Act. Repeal? No, that's
well, then
not
he's
happen.
right, basically.
No, he isn't. No, he isn't. He's saying you have to have a bill. And we have something that actually was developed at the Heritage Foundation, a Republican institution, a conservative institution. Romney Care.
The individual mandate.
The individual mandate, Romney Care in Massachusetts, a Republican governor. So would it have been the bill I would have written? I would have had a public option. I would have done a different bill. But this was a private sector, market economy piece of legislation that works. It's implemented. So it's rolling something back. You have to be totally irresponsible to do that.
Leader Pelosi, thanks so much.
Thank you. My pleasure.